Hi, this is Doug Levy. I've been getting some questions about President Trump's COVID diagnosis and what it means, and I thought I'd share a few thoughts here. My personal hope is that this helps persuade more people to wear face coverings. And I don't mean that politically at all. What we know from overwhelming evidence, overwhelming data from across the United States and around the world is that wearing a face covering not only protects others if you are infected, but even a simple cloth over your nose and mouth will reduce the amount of infectious material that you take in from somebody else. And that means even if you get COVID 19, you're likely going to get a milder case and recover faster. So, here are a couple of things to consider as we think about what happens now. If yesterday was the first time that the president's test had a positive result, that means most likely he was infected because he was exposed to somebody who had the disease Tuesday or earlier. The virus generally doesn't show up on test results until between 2 and 5 days after exposure, and sometimes even longer. That's why we tell people to isolate for 14 days after known exposure. Early signs of COVID 19 include things like confusion or reduced mental sharpness. And the worst symptoms usually start showing up in the second week after infection. We'll have to see. We do know from the White House that the president has shown mild symptoms, but we don't know what those symptoms are. There were some reports that the president appeared to be a bit subdued when he appeared at a fundraiser in New Jersey. Don't know. There's also a lot of confusion about the different types of tests. The rapid tests, like the ones being used at the White House and entrances to sports stadiums and so on, are antigen tests. That means they're testing for proteins that are part of the coronavirus, and they can be run very quickly, but they are also not as specific as the fancier lab tests, which are called PCR, polymerase chain reaction. Those tests take a small amount of genetic material, amplify it so that it can be detected. And the difference is that the antigen test, if an antigen test turns up positive, it is extremely likely that there's a real COVID-19 infection. But a negative test doesn't really tell you much. It indicates that more likely than not, there was no infection at that moment when the test was taken. But if the exposure was within the last 2 or 3 days, the test might be negative, even though the infection is starting to take hold in your system. Bottom line is that any test that has a positive result is highly likely to reflect actual COVID-19 infection. But a negative result at best tells you that you aren't infected at the time of the test. Now, if you have a positive result, there's many people who have no symptoms, and even people who do actually get sick, most recover. There are some people, though, who do very poorly and die. President Trump is in a high-risk category because of his age, his weight, and other underlying health conditions that we know that he has. With that said, President Trump has all the odds in his favor. His access to the best healthcare, top physicians, and most importantly, his physicians have access to the drugs that we know work, such as remdesivir. The reality is that if you aren't at the White House, you may not wind up at a hospital that is capable of giving you the best care. And even the best hospitals have been struggling to get supplies of the drugs that they need to keep people safe from COVID-19. So it's an uncertain time. I'm certainly hoping that the president, the first lady, and everybody else who is infected recovers well. We want this disease to be under control. So the message is clear: cover your face, give others space, and wash